Hello, and welcome to Celiac.com news. Subscribe to our channel to get the latest celiac disease and gluten-free diet news. And if you have any questions, be sure to join the Celiac.com forum online at celiac.com. And now, let's move on to the latest Celiac.com news. Understanding the link between early celiac disease diagnosis and kidney health. Celiac disease is an autoimmune condition triggered by gluten, a protein found in wheat, barley, and rye. When individuals with celiac disease consume gluten, their immune system attacks the small intestine, leading to inflammation and damage. Over time, this immune response can extend beyond the digestive system and affect other parts of the body, including the kidneys. This study explores whether early diagnosis of celiac disease and adherence to a gluten-free diet can reduce the risk of developing immune-mediated kidney diseases. Celiac disease is already known to be associated with other autoimmune conditions, such as type 1 diabetes and thyroid disorders. However, its connection to kidney diseases has not been thoroughly investigated. Immune-mediated renal diseases, or IMRDs, are a group of kidney conditions caused by abnormal immune system activity. These diseases can lead to kidney damage and, in severe cases, kidney failure. The study aimed to answer two key questions. Does early diagnosis of celiac disease reduce the risk of developing IMRDs? And does prolonged exposure to gluten increase the risk of these kidney conditions? To answer these questions, researchers used data from Swedish national health registers analyzing the medical records of over 3 million individuals. They identified people diagnosed with celiac disease and compared them to a control group without the condition. The study focused on individuals diagnosed with celiac disease before the age of 30, examining their risk of developing IMRDs based on the age at which they were diagnosed. Participants were divided into two groups, those diagnosed before the age of 15 and those diagnosed between 16 and 30. Researchers also examined whether the risk of developing IMRDs changed before and after a celiac disease diagnosis. The study revealed several key insights. First, early diagnosis appears to reduce the risk of kidney complications. Individuals diagnosed before the age of 15 had only a 12% increased risk of developing IMRDs compared to the general population, while those diagnosed between 16 and 30 had a significantly higher risk, 60% above average. This suggests that early diagnosis and treatment with a gluten-free diet may help protect kidney health. Another major finding was that, for most of the IMRDs studied, the risk of developing these conditions decreased after a celiac disease diagnosis. This reduction was particularly notable for conditions like acute nephritic syndrome and rapidly progressive nephritic syndrome. The data also suggested that prolonged exposure to gluten before diagnosis may increase the risk of IMRDs. This aligns with the idea that untreated celiac disease can lead to widespread inflammation, which may eventually affect the kidneys. For individuals with celiac disease, this study underscores the importance of early diagnosis and strict adherence to a gluten-free diet. Removing gluten from the diet allows the immune system to settle, reducing inflammation and potentially preventing complications in other organs, including the kidneys. The findings also highlight the need for greater awareness among healthcare providers. Because celiac disease symptoms can be subtle or mistaken for other conditions, delayed diagnosis is common. Early testing and intervention could significantly improve long-term health outcomes for patients. While the study provides valuable insights, it does have some limitations. Researchers did not have data on whether participants strictly followed a gluten-free diet after diagnosis, which could impact results. Additionally, some kidney conditions may have been misclassified due to limitations in the diagnostic codes used in the health registers. Since the study population was primarily Swedish, the findings may not apply universally to all populations. Despite these limitations, the study sheds light on the connection between celiac disease and kidney health, emphasizing the benefits of early diagnosis and treatment. For individuals with celiac disease, following a gluten-free diet not only protects the intestines, but may also safeguard the kidneys from immune-mediated damage. For the broader celiac community, these findings serve as a call to action. Raising awareness about the condition, improving diagnostic tools, and ensuring access to gluten free foods can help reduce the risk of complications and improve quality of life for those living with celiac disease. To get the latest celiac disease news and information, be sure to subscribe to celiac.com news. Thank you for tuning in, and see you next time.